Good evening and thanks so much for joining us tonight at 6. I'm Mike Thompson. Emergency room visits for suicide attempts are going up for teenage girls. News 8 Now's Tyler Jobe is live in our studio tonight to explain why girls are more at risk than boys.
Mike, the pandemic has amplified the struggles for people dealing with mental health problems, including those experiencing suicidal thoughts, and it's leaving experts wondering what we can do better to get them the help they need. Suicidal thoughts affect people of all ages, but right now, teen girls are feeling the most impact.
During the adolescence, they are at the peak for suicidal thoughts.
Angela Barnes, adolescent therapist for Gundersen-Health-System, says during the pandemic, ER visits for teen girls with suicide attempts have gone up. She says changes in family and school, as well as social media, are contributing factors.
Females have just for a very long time engaged in self-harm more frequently and more often than males.
The trend at Gundersen is going along with what's happening on state and national levels. According to the CDC, last winter, 50% more teen girls ages 12 through 17 were admitted to the emergency room for suicide attempts compared to winter of 2019. A report by the Wisconsin Office of Children's Mental Health also shows a similar trend. But Director Linda Hall says the pandemic could have some silver linings for these teens.
Their behaviors that are indicating a suicide risk are being noticed. We're hopeful they're getting help before anything more serious would happen.
Hall says one way to get teens help right now is by putting them in touch with more adult support.
When kids feel connected, they feel like they belong.
That's why there's resources like Great Rivers 211, where staff like Amy Kuster are available around the clock.
It's always safe for people to call here, no matter what.
Advice to people, especially young girls, that it's okay to seek help whenever they need it. Now, Kuster says since the start of the pandemic, calls to Great Rivers 211 relating to mental health and addiction are up 14%. Mike?
Okay, thanks a lot, Tyler. Barnes says your local healthcare provider and school counselors are other good resources. We're going to post a list of those at news8000.com.